So this is actually joint work with Otis Jennings. At the time we started this a couple of years ago, he was at Columbia University. Now he's a consultant. And William Macy is actually supervised my thesis at Binghamton University. He's based at Princeton University. Really the basic about the talk is how to plan for beds in the nursing home. So talk about nursing homes. There are different kinds of nursing homes. I just focus on what we call skilled nursing homes, where patients go to get that kind of skilled nursing care. The other type of transition nursing home, like for rehabs. So those are not the ones that I focus on for this research. And even for those skilled nursing homes, they might have different units. I just focus on the long term for those residents who stay there for a long time. Really the focus for this is beds. There's multiple facets you can look at nursing home problems. I mean, from nursing, staffing, and other elements. My focus is just on the bed. I'm going to wait for Kathleen just for a few seconds.
Do you have a phone? Sure.
All right, so great. So I'm just going to focus on talking about beds. How do we allocate beds? In terms of background, I actually look at this from 3 different angles. So the demographics, what do we learn from demographics? The need, is there a need for beds? And the payer mix, who pays for the services? In terms of demographics, right now we know that about 88% of nursing home residents are actually 65 and older. We know baby boomers are retiring. And indeed, by 2030, about 20% of our U.S. population is going to be that age cohort of 65 and older. That's going to be about 72 million. If you do a little bit numbers, right now it's 13%. It's going to be about almost 80% increase in that age cohort. Actually, when you look at the data in the past few years, 4% of this age cohort tend to be in a nursing home. So if you extrapolate this, it's about 3 million nursing home beds by 2030. So you look today is about double that by the time. So clearly there's a need that's expected to increase over the next couple of decades. So we know that, and it turns out that who's going to pay for this is Medicaid. So most of those patients, residents that stay in the nursing home for a long time, are going to end up on Medicaid. Through the process, especially in New York State, they could spend down, you have to spend everything you have, and then Medicaid takes over. So the fundamental question now, you can ask, we know there's a need, we see that there's demographic changes. Yes, we do know that Medicaid will pay for this. There are actually 3 different ways you can ask this question. From the state level, they're interested to know how many beds do we need to control the costs and to actually really supply the beds to minimize the waiting list of those people needing those beds. But if you own a nursing home, you might actually start looking at this a little differently. So given the demographic changes and the projection, how many beds are needed for me to maximize profitability? It's a little bit different objective function. You look at this. Also, you're going to have to worry about what are the regulations that are going to prevent me from doing what I want to do, or are going to limit me in what I'm going to do. The biggest one, especially in New York State, is certificate of need. You can't just get up in the morning and decide, okay, I see the projection, I'm going to start getting a nursing home. You have to go through a long process to be approved for those beds before they add it on there. There are also other regulations that even when you have the beds, how are you going to get paid for this? So there's this policy that in New York State that we call bed hold policy. So I talked about this more towards the end of the talk. And then, come in, Rachel. Then if you are actually potential residents, you have a slightly different objective function too. So you're actually worried about knowing, okay, are there going to be enough beds if I need one? Actually, even better, are there going to be better alternative to nursing home care? That's really what you care about as a patient, okay? It seems to be the last place probably in a potential patient wants to be. So for this talk, we didn't focus more on the state level or even potential residents objective function, we actually focus more on the owner. So, because it's easy to model and understand what's going on, because the objective function is measurable. So I know there's going to be need. Once you know what the need is, what do I need to do to maximize for stability? So that's essentially what we did. Okay. So the research challenges for this problem, actually, it's lack of research itself. So in the US, there's actually limited research about how you go about planning for beds. You know, it seems like people just, first of all, it's so hard, for example, in New York State to build a new nursing home, that people don't think about these problems every day. So there's really little research in the US on how you actually go about doing this. Outside of the US, yes, there's some papers that talk about this, but it's a little different payment methodology. Most of the state pays for this, and the objective really function is how do we minimize waiting lists. Essentially, that's what tend to be what people read about. There are probably very few or none of these nursing homes without private. So there's actually some really good papers about this for the Canadian system. Then once you start looking at the modeling side itself, there are also challenges. So we know that there are certificate of need. They're going to prevent you from just changing the number of beds. So to add a bed, you have to apply. To remove a bed, you have to apply. So you actually, you have to look strategically and the long term, what next 5 to 10 years, how many beds do I need to maximize profit? So you have to be the magic number that you need to come up with. And really the whole thing about the talk is how you come up with the number. Because you're not going to be allowed to keep changing. So you have this long-term planning, but over short-term transient behavior. You know your system always goes up and down, right? So you have to look at those transient behaviors and then think about the long-term planning. So right now in the US, the average length of stay in the nursing homes is about 2.3 years. Okay? If you plan for 5 years,
That's longer than I thought.
in New York State it's different.
New York State is different.
Yes, very different. And actually the difference also is when you work in New York State, they don't differentiate between rehab residents and long-term. So you get like, no, you don't get there like that. So you just get nursing home residents and they combine them all. When you do the average of length of stay, it actually becomes in a year or even less. But nationally though, it's 2.3 years.
Thanks.
So now if you have 2.3 years and you're going to apply for 5 years, mathematically your system is not going to reach a steady state. Okay, that's one of the challenges. So you can't just say, okay, I just look at the equilibrium and just plan my beds that way. It's not going to happen that way. That means that your initial condition will make a difference in how you plan for your beds. So the number of beds you have now will change your planning because of the transit behavior. Okay. So the proposed modeling for this talk, we're just going to use stochastic analysis. This is actually based on queuing theory. This queuing theory itself was initially invented to study the problem of leasing shared resources. For example, the trunk lines. So people in telecommunication championed this area of operations research way before. It's been very successful. Essentially, you're saying, given this population and given this number of phone calls I get, how many trunk lines do I need? That's how the whole thing started with the queuing theory. So we actually realized we actually could use this. And in fact, if you think about this, you have a bed, no one's going to buy a bed. You're actually going to lease it for the short period of time. Now the question for us is, how can you apply the same models and try to have some ideas, the optimal number of beds someone may need or an owner might need to maximize profitability. Okay, so in stochastic terms, so every time we have a queuing system, they're going to be 3 elements. You have a customer. So if you go to Walmart, you're going to be the customer. There's going to be an agent that's going to check you out. This could be a machine or it could be a person. And there's going to be a manager who decides how many agents do I need to meet some performance measure, maybe to minimize the waiting lines and things like that. So for us, actually what we want to do, in the place of a manager, we're trying to think how many beds do we need. Those are the agents for us. And then when it comes to demand, so every time we have a queuing system, in general, it could be ED, emergency department, it could be a store. If you're gonna go to the bank, go to the emergency department, you don't call the people say, hey, let's go to emergency department. So we assume independent behavior. That's where this Poisson process comes in. So the Poisson process is built on dependence of these random events. The time homogeneous, this means it changes with time. Okay? It makes the mathematics a little bit more challenging because, again, as we said, it's not homogeneous. It's not a rich steady state. Okay, so what about service time? The service time is the amount of time you're going to spend in bed for us. So the age is the bed, the arrival is Poisson, and the service time is the amount of time you spend in bed. So you can actually look at this in what we call Markovian version of the queuing model. So by Markovian, every time you see that, it's just there's some sort of a memoryless property. Those people willing to get a bed, right? We have beds, and then back up just a little. So this Q here is what we're going to use to represent the number of potential residents waiting for a bed and those who are in bed. So take those two numbers, add them together, you get this QT. Okay, it's a stochastic system. It's not just one constant number. It also changes with time. Then, if you take the total number, makes sense. Total number of people waiting or who are in bed. You take away the number of beds that are there. It gives you an idea who's waiting. You can compute that. And the plus here, this terminology means when it's positive, because we don't care when this is not. This quantity is negative. And then there's this arrival rate. So how many people are calling the nursing home asking for beds? This was actually, through this research, a number that no one seems to have. Even nursing homes, I don't think they have a way to capture this. If you call, I'm looking for a bed, you have no beds, I think that's the end of it. I don't think the number is captured. So it's going to be, I'll show you later how I actually went about estimating what this number might look like, but it sounds like no one captured this number. And then we have this service rate. Okay, so if you take this mu, actually you make it 1 over mu, that's actually the average amount of time we're going to spend in the bed. Okay, so as we said in the US right now, that's 2.3 years. So this term right here is a departure from the system. This is the arrival in the system, and this is how many are either in bed or waiting for the bed. Okay. Now, so if once you get this, a natural way usually is if you're waiting for a bed and the bed is not available, you start looking for alternative nursing home. Or you start looking for alternative care, like home health care or other areas. So this term here is 1 over theta. It gives you how long you wait until you start looking for, if your favorite nursing home is not available, until you start looking for your second favorite. So the general assumption here is you're going to call for a bed. If the bed is not available, you might wait just a few days or a little longer. If you still can't get a bed, you're going to try to find alternative care. So that's the general assumption behind here. I don't think it's too far off. Obviously, this is mathematics. Some of the assumptions that we make is to make also our modeling a little bit easier to understand. But we believe that's quite close to the reality. Okay, so with this, again, we're trying to solve the problem of an owner. Look at demographics and the need and say, how many beds do I need to maximize profitability over the next 5 to 10 years? They might be thinking, wait a minute, if I have too few beds or too many beds, for whatever reason, I have people who won't be able to wait longer to get a bed. So you have to think in terms of competitiveness. You don't want to lose a lot of money to your competitors. So let's start with the competitive case here. So the objective function for you is, so this number here, the minimum of those people in bed all are waiting, and the number of beds available. This gives you the number of beds being used. So you get paid for you to have a resident in bed. That's how you get paid. For each bed you're going to have, you're going to apply for, you're going to build, they're gonna be some expense you do it. This could be your staffing costs, your maintenance costs. So you have to think about this. And then T is your planning period, 5 to 10 years. So this is gonna be your revenue. So it's usually in a nursing home, usually paid every day. Okay, $300, $400. So I'm not sure what the Medicaid rate is. It might not be as generous, but it might be all you get. Okay, and then you have the costs for your beds. This is the general problem we try to solve here. So the rest of the talk is going to hinge on this simple problem. So right now, the question we can ask right now: how do we find B? What's optimal B? Okay, you can in mathematics, or you can say, oh wait a minute, you can just differentiate that and give it B. But you can't do that because we don't know what this stochastic system is here. We can't characterize this yet. So if you can't characterize this stochastic system here, you cannot differentiate and get the optimal B. Okay? So we have to come up with some clever ways on how to do this. Okay. So one way is actually look through the fluid approximation. So you have this random system. Why don't you just look at the average? That's what we'll do. So just look at the average of the system. It's giving us some idea what's going on, right? So that's essentially what the fluid approximation is. So when you have a queuing system, so from this great paper of Mandelbaum, Mason, and Reimann in 1998, it was about a strong approximation of Markovian service network. They show that if you scale up your number of arrivals and you scale up your number of servers or agents, actually your system, in probability, converges to this average behavior of the system. Okay, so we could do the same thing for our system, and simplify our objective function to something like this. We replace the BQ with this little q, which is the average behavior of the system. Okay, we still don't have to find the B yet, and even here we still don't know how to find it. But if you look at this, so this is the rate of change of people in the system. Okay, so this first order dynamical system gives us actually what's the rate of change at a given time in a system. So it's the arrival rate, people calling for beds, minus those who live to find at the beds or at the nursing homes, minus those actually who leave the system. Okay, so this rate of change is what represents the dynamics of the system. This is our objective function. We still don't know how to find this here, but at least we have a problem that we can solve. If you've taken control theory or even classical mechanics, you can actually see that you actually can formulate this problem as a Lagrangian problem. You can combine your objective function with your equation of motion and come up with this Lagrangian function that gives you these two dynamical system that you can solve to understand what's going on with your system. Okay, we know you can do this, but this does not make our problem any easier because at this point, this is mean Q and B. We have an area of non-differentiability, so you can just take this Lagrangian differential with respect to B and come up with the optimal number. There still has to be some clever method on how you're going to do that, how you're going to come up with this solution. So actually, usually what you do, you change this into Hamiltonian and then find the necessary condition which should give you the optimal B. So numerically, we can use Euler or even the Runge-Kara method. You solve forward, backwards until your system converges. But that does not still tell us what B is. So for the next case, I'm going to actually, we try to solve an easier problem than this, where we assumed that instead of you waiting to go to the second nursing home, you actually going to wait forever. Okay, so either you're in bed or you're not, type of problem. So this is almost like what we call a monopolistic case. You're in an area that either you get a bed or you don't get a bed. Okay, maybe it's not quite reality in a sense, but maybe also it is. There might be a place where either you get a bed or you don't. Okay, so we assume that this assumption where this is abandonment rate, so that you live in the system to find a second nursing home, and this is the service rate, so you actually live in the nursing home bed. if you make these two equal, the mathematics becomes so much simpler. So how does that happen? So you still have a simple parametric function, but once you make those two rates equal, our system simplifies. This didn't show up right. Our system simplifies to a system like this. We don't have the same Markovian system anymore. We actually simplified that. We have the arrival rate and departure rate. That's what we have. That's what we see. We do not see the abandonment rate because those two rates are equal. So the amount of time you spend waiting for the bed equal the same amount of time you spend in bed anyway. That's what that means. So in 1943, Asher Palm showed that whenever you have a queuing system like this, if the initial condition has a Poisson distribution, the system becomes what we call infinite server. So the system behaves as you have infinite number of beds. Okay. In other setting, that would be infinite number of agents. So this is what we call MG infinity. So this infinite server is what our problem simplifies to now. So which means, so whenever you have this infinite server and you have exponential service time, by exponential service time that means also some sort of independence and the memory is properly within the service time. This means that the time you leave the bed should be independent from the time another person leaves the bed. There should not be, unless there's something going on within a nursing home, those two should be independent. So once you do that, actually you can use a Poisson distribution to characterize your queuing system. You can use this simple formula and have some idea the probability that there is n number of residents in bed, all those waiting for a bed, is given by this Poisson distribution. Okay. So what does that mean? That means if you do this, if you recall, we use this terminology in our objective function to decide the number of busy beds. That's how you get paid. If you replace this with the Poisson distribution assumption, and then you have this what we call blocking formula, we actually come up with this formula. Okay. If you're interested to see how we grab this, I'll be glad to show you the paper. You can take a look at this. And then with the assumption of theta equaling mu, that means the abandonment rate equals the service rate, it reduces your dynamical system to a much simpler system that you can actually solve analytically. You can, using integrated factor, you can solve for this, depending on how the arrival rate behaves. Okay, you can do that. Okay, so also with that is, these are the identities that you can note that we use with the paper. If we know that, so if you can estimate the number of busy beds, okay, which is this, that's this, okay, we can estimate the number of busy beds. That also means we can estimate the rate of change of those beds, okay? So once we differentiate this with the Poisson distribution assumption for your queuing system, you get to something like this, okay? And again, we're assuming that the service time is exponentially distributed, meaning the time you finish your service is independent of the time the resident finishes a day service. Okay, now, sorry. Okay, so after we characterize this means we can take, so we just estimate this using the Poisson distribution, replace this with this term, and now we have actually different objective function. It's the same objective function we try to solve. We still try to find the optimal number of beds. It's just the mechanics we're going through to find that. We get something like this. So this does not make matters any easier at the thematics level. And the reason for that, this factorial term, it's not clear how you're going to differentiate this with respect to B. It's not helping, okay? Certainly you can do this numerically. You can always do these things numerically. And with these factorials here, just take the Stirling's approximation and do that and come up with what the solution is. But it won't be analytical. So what we do with that, so there's actually a clever method that at least the time I spent studying approaching research never seen, and speak to my advisor, he hasn't seen people applying this. It's what we call decreasing rearrangement. Okay, so in 1959, Hardy, Littlewood, and Polya, which is a little bit more known mathematician than the other two, at least from my perspective, they showed that if you have an increasing function, and if you take a decreasing of the function, and you integrate those two functions, they are actually equal. Okay, so f of qt here is going to be equal to f of q star. Q star is a decreasing rearrangement for the function. Okay, so where we're going with this? That means that if these two things are equal, we don't need the solution for this one, but we can find a solution for that one. Okay, so if we can convert our original objective function, replace first of all this q of t with its fluid approximation, which is little q. If you're going to differentiate this with respect to b, we're only interested in the cases where this q of t is greater than b. Okay, so we actually can now start having some idea how we can approximate this. We assume b is continuous, and we write the problem this way. So actually, if you differentiate with respect to the upper integral, all you're going to end up with is something like this. Okay, now we have a little bit solution. So this is solution to this, but since those two functions are equal, it turns out that this is also solution for that. Okay. So we take a dimension of this. We try to put some interpretation on what this decreasing rearrangement means for this system. So which means that we can actually come up with a solution to our problem. This is optimal number of beds we need to maximize proof stability. After you go through that, you can show that the objective function, once you maximize it, it equals this. So this is the optimal number. What does this optimal number mean? This is the argument of the decreasing rearrangement functions. It's your cost divided your revenue times your planning period. Very, very simple formula in the end that you come up with. Take your cost divided by your revenue times your planning period. It gives you the time that you can invert and find what the optimal number is. So what does this mean if you interpret this? If you minimize costs or you increase revenue, you're going to want to have more beds. That's just what it is. Okay? It's just intuitive. There are two ways that you want to have more beds. The cost goes down or the revenue goes up. That means that it's going to shift to the left, and once you invert that one, it gives you more beds. I'm going to show you an example towards the end. Let me quickly show you the proof to that. I don't think we need to spend more time on this. So that's the proof on how you come up with that. I can definitely share with you more later if you're interested in how we did this. This is just how you differentiate this and come up with that. Okay, let's now talk about New York State. Okay, that was a general problem that I actually can call an unregulated nursing home. We did not talk anything about Medicaid yet. Okay, so once you put Medicaid policy, things become complicated. Indeed, this paper was actually inspired by the policy in New York State.
Coffee for this part.
Okay. So what's going on in New York State? New York State, obviously, there are a couple things here. So the certificate of need they had to apply for. And then we have this bed default payment policy that comes. If they allow you to have those beds, they also have more regulations. These are not the only regulations. It's just the ones I think financial makes a difference if you're planning. At the certificate of need level, I look at three elements. Okay, first of all, the payer mix. Who's paying for this? In New York State, it turns out that 71% of the nursing home residents have Medicaid. This is also tricky here because I had no way to differentiate between the short-term stay and the long-term stay. Usually short-term stay is 30 days, and long-term stay is a little bit longer than that. But in New York State, when you get statistics, just one number. Actually, really what it turns out to be, at least from listening to the professionals who work in nursing homes, if you read long-term in nursing homes, it's just sooner or later going to be on Medicaid. So actually the number might be much greater for those who are long-term patients, residents in nursing homes. Then when it comes to this Medicaid, obviously it's the same objective. They're trying to control the beds. So if you want to add beds, you apply. And the reason why in New York State they're going to be so difficult to build a new nursing home is every time they like to build a nursing home, they also pay you to build the nursing home. So there's actually reimbursement they give you for building a new nursing home. So those new beds you get is something they call a capital payment reimbursement. Okay? So nursing home will have to have this, which means the state probably won't allow you to build them in new beds. And the other thing that happens with this, that shifts, I think right now, I'm not sure, but I think right now the formula for reimbursement, the rate is based like in the 1980s, that they keep just adjusting for inflation, okay? So when you build a new base though, your payment shift to now, it's a little bit more. So it's really gonna be hard in New York State to build a new nursing home. That's just the point here. And then also you have to be careful again, once you build a nursing home, the beds have to be enough because if you build too many, there's a consequence. That comes through this bed hold payment policy. Okay, what happens with this? So if your nursing home is less than 95% occupied and a resident goes to a hospital or leave of absence, those days the patient is gone, the resident is gone, you don't get paid. If at the time the resident left, you were 95%, you were less than 95% occupied. So you absolutely have to be careful because obviously also this number is random. You don't know who's going to leave and how long they're going to be living for. So you have to plan for this. So this actually makes the model a bit more complicated. In New York State, there's not that, I mean, each resident is given a certain number of days they can have in the whole days. It's not clear what happens after you use all your days. I think it's actually not that many, maybe like 20 days. But I don't think, because essentially what happens is, if you can't just give the bed away, okay? If you give it away, another one opens, the person has to take priority. And also, it's not good customer service anyway. So just because I don't get paid, I'm gonna give away your bed. So there's this limited number of beds. We don't include in our model for analytical purposes. We just include this vacancy rate. So we're trying to keep this vacancy rate less than 5%. Okay. So that actually going to change. So if you think about this, in terms of having at the B number of beds we just found, you might have actually a little bit less number of beds because you want to account for this event happening. So graphically, what does that mean? So you have occupied beds you have to worry about. So all my beds are going to be busy, and then you have a problem with empty beds now. I don't want to have too many empty beds. Even if I don't assign nurses to those beds, I still won't get paid if another occupied bed becomes empty. So now you have this problem of reserved beds you have to worry about. So you have to make sure that your reserved beds, which is the bed you're holding, they are getting paid for. Okay. All right, so I'm going to run through this quickly. It's a little bit more mathematics. Actually makes the problem a little bit more challenging. So essentially what you do here, you add on this term here. So this is the probability of a patient go to the hospital or leave of absence. And this epsilon here is a vacancy rate. So if the patient leaves and you're less than this 95%, so actually this term is 95%, that means you're gonna lose the revenue. These are multiplied this whole term. So the patient leaves and your occupancy is less than 95%, you lose the revenue. That's what the whole terminology means. We know already that even solving the original simple problem is not easy. This doesn't get any easier. So what happens then? That's what those terminologies are. We can actually go ahead and substitute the Q with the Poisson distribution. We know what that is. It becomes quite messy. It's not easy to solve. So what's our contribution here? We're trying to get to something simple like this that we had before. So obviously this is the original solution plus something. So the contribution, how we get to this. So what we're going to do, we know what the solution for this first term is. Okay. By the way, this is integral. You can separate this. You don't need to have them the same way. You can integrate this first and then integrate this separate. Okay. So we know what the solution for this is. But to come to solution for this, we do not have a magical decreasing arrangement again for us to give out the solution. So what about if you smooth out this queuing system using this approximation, Gaussian, normal Gaussian, where the mean equals the variance? Okay? What about if you do that? Then you can actually write out a new objective function. It's really an approximation. It's not the same one as we had before, but this is going to at least guarantee you will be able to find the optimal number of beds. So we went through the process, and sure enough, we come up with this. So this is actually now optimal number of beds that you're going to have over T period, 5 to 10 years. You can choose these parameters. This is a probability. It can be historical. Historical how many patients or residents to leave for leave of absence or go to the hospital. And then this epsilon is determined by the state. You don't need to define it as 5%. And then this is the Gaussian term that you add on there. So once you put this together as an argument of the decreasing rearrangement of Q star, and then you come up with this B star. Okay. That was a lot of numbers and parameters, but we want to do this. At least in my idea, when I talked to my advisor, I said, that's great, we did this, but what does this mean in reality if you're not doing nursing home? Okay, we decided, okay, let's get some data from counties. Essentially, remember we're talking here about a monopolistic case. If you think maybe at the county level, if you live in a county, you really have to want those nursing homes. That's how we're thinking about this. What would you get? So what we did, we came up with the algorithm that you can take the statistics from a given county and apply our formulas, have some idea what the optimal number of beds should have been historically. There's still a challenge here because we know that there's going to be an increase in the people needing bed, but that actually is a separate problem that you need demographers to actually solve. Because if you're building a nursing home in New York State, the projections are a little different than if you're building one in Florida. So we might not need as many beds in New York State, but we might need more in Florida, just the weather by itself. So we didn't actually try to solve the problem. What we did here, we know that our model can be used for future planning, for sure. If you can project the number of people who need the bed, we can tell what's the optimal number of beds you need. But what actually we did to prove this, we looked historically to see what would have happened if you'd applied the model. So we come up with that, and then we also come up with to estimate the optimal number of beds. So how do we do this? In New York State, there's actually a database. It's called Metrics database. Okay. Every week, every nursing home reports the number of busy beds. So we have some idea on occupancy for each nursing home.
Jerome, I'm sorry to stop you. I just need a point of clarification for the definition. So now when we're talking about nursing home beds, are we talking about long-term care and rehab, or just long-term care?
Just long-term.
Okay.
Unfortunately, in New York State, those two are combined. Okay. So in New York State, the two numbers are combined.
Even in what you're talking about here?
Even here they don't give you right. Even here you don't know who's a rehab. And
yeah, because the clinical, that's going to throw your...
Yes, it does. Even in mathematics, you're not estimating your parameters right. But you really have no choice. I think what's going on here, though, most nursing homes make money on those short-term stay patients. Okay, maybe there's a need what they do. The data have to stay that way. I'm not quite sure why they won't separate this because we try so hard to find it. But the only thing you can see is, okay, these are how many beds I have, not type of beds, and this is how many beds are busy. Every week you see this. And I think the original intention for this database was actually to allow to transfer patients from hospital to nursing homes. So a hospital can go there, like a utilization review manager, and see, okay, we had to transfer this patient out, which nursing home is likely to have a bed. That was the intention for this. We just took advantage of it to try to have some idea for our own model to understand what's going on. This is it's nice. It comes in the Access database, so you can actually go and do some interesting stuff on it. Also, I think they provide this in Excel. So the step one, what we did, we estimated the number of busy beds using the same formula again. How do we do this? So we're going to take the number of occupied beds, okay, add them up, and just average that over the number of nursing home in the county. That's what we did. So this actually estimates this term here. And then in terms of the beds available, you just, because they give an occupancy rate, you can know how many beds they have. So if you go to how many beds each nursing home has, which is nursing home I, and you add them all together, also you average those, you can have some idea of how many beds you have in a given county. So you take from step 1 and 2, you can estimate what we call offered load Q. The little Q that came up before in our mathematical models is actually the service demand. How many actual beds are required in a given county. So you can estimate this. And then there's also this term that we had before. You can also estimate this. And the way we did this is if you know each week, we know how many beds are occupied. So take the 5-week moving average, and that gives the rate of change in occupancy, and then you can use the number to estimate this. Okay? Why are we estimating this anyway? So the reason for us estimating this, we're trying to come up with something interesting, is actually how many people are calling asking for beds. What's the process look like? Or people demanding beds? Because once then you know this number, you can plug in a formula and come up with the optimal number of beds that you need. Okay? So we did all this, we estimate this, and we actually look at several counties. So for this talk, I want to show one county, Greene County. And the reason why I show this county is probably one of the most profitable for nursing homes. A lot of nursing homes lose money. So if you actually really look, we spend time looking at the financial statement. A lot of them are written in the red. So this was the only county that we could find that had interesting projection in terms of the bed need for the county. So when you average out, it was about 129, 130 number of beds. We average out all the counties nursing home, and then we use the data. We estimate what the expected busy beds within a county. So how that went. So, and that was easy because this came from the data. And then with that, we can now estimate this little Q again. So you can go back to our mathematical formula, apply the data, and come up with, this is actually how many beds you need. Okay? Obviously, you can see here, if you look back here, you can have occupancy greater than 100, essentially what they're saying. Okay? Just because your occupancy is almost 100, or is even 100%, it doesn't mean there are not people waiting for beds. Okay, that's what the Rearrangement can tell you. What's the demand for those beds? And you can see also the peak comes when you have about 100 occupancy. You can see that from there. And then this is the one interesting one. It still didn't make sense to us when we saw this, but this is a candidate function that estimates how many people are calling looking for beds. The number is not there. We just estimate from the data. So if you use a function like this, and you plug in our model, it's going to give you the same solution that you have. But since no one collects this data, this was our way to estimate this. It kind of does not make any sense the way it goes up and down, but if you apply it to our model, it gives the right results. It's just, I'll call this maybe a candidate solution to the demand for nursing home beds. So that's that, and then we did the decreasing rearrangement to see. So that's actually the little technique that we use for those two equal functions. Once is the decreasing, the other is the increasing function. If you plot that out, you do some inversion, so the numbers are cut off at the bottom. You can actually come up with the optimal number of beds for this. So for us, this was the, it's hard to see here. So this was actually what's available in a county, and this is what we propose for them to have 120. They had 128. And this, and here's the problem in New York State also. The length of stay in weeks now. It's 90 years because those statistics are combined. Mm-hmm. But in any case, for them to maximize profit, given the bed hold policy, instead of 128, you should have 120. That's essentially come up with that for the county. And we even did this at the profit side. Some of this we solve the complex functions numerically, come up with what the solution is, and the red line here shows actually our estimate using one part using decreasing arrangement and the other part using the Gaussian approximation, and it still gives us 120. They're all about the maximum anyway, so Actually, if you use, so they have 128, settle down here. We say you can have 120. Actually, the optimal says 117. Remember, this 120 is the area within the approximation of the model, okay? But in any case, the optimal profit is a little less. It's a little about the same because they're all about the optimum of this profit. So this is our estimate using the Gaussian approximation. This was actually the optimal using the Poisson distribution. So 120 to 117, that's error within the model itself. So conclusion, so nursing home, there's, when you plan for beds, so there are some things you have to think about, especially in New York State, the certificate of need, the bed hold policy, you're trying to maximize profitability. So there's a problem of long-term residual lifetime, so your system may not reach a steady state, especially if your average length of stay is a little long, and you're planning for, it's a 2.3 years, you're planning for 5 years. So that means your initial conditions are going to make a difference in how many. And in fact, when we did some for the Greene County, and you test different initial conditions, we get different results. But it depends where you start, that your system will give you the solution. And then our contribution was obviously, providing method to solve the simple problem, the objective function, and we provide algorithms to do this. This was one of our many contributions. The limitation for our research, we did not treat different case mixes of patients, of residents. So this actually makes a difference in how you get paid, that's one. Also it makes a difference in your length of stay. But for us, we just took what we call homogeneous population, assuming that the length of stay is going to be the same. We also did not account for the demographic shifts. We know overall in the US, this is what's going to happen next decade, couple of decades, but we don't know in each region what's going to happen. So as an investor or a nursing home owner, you have to add the layer to your analysis. So how is that going to be the demographic shift in my area for this? Don't just use the national statistics, use actually your local statistics when you do this. So these are some references, and thank you for being such a great audience.